Petrous part of the temporal bone. The petrous part of the temporal bone is pyramid-shaped and is wedged in at the base of the skull between the sphenoid and occipital bones. Directed medially, forward, and a little upward, it presents a base, an apex, 3 surfaces, and 3 angles, and houses in its interior the components of the inner ear. The petrous portion is among the most basal elements of the skull and forms part of the endocranium. Petrous comes from the Latin word petrosus, meaning stone-like, hard. It is one of the densest bones in the body. In other mammals, it is a separate bone, the petrosal bone. The petrous bone is important for studies of ancient DNA from skeletal remains, as it tends to contain extremely well-preserved DNA. Base. Edit. The base is fused with the internal surfaces of the squamous, tympanic, and mastoid parts. Apex. The apex, which is rough and uneven, is received into the angular interval between the posterior border of the great wing of the sphenoid bone and the basilar part of the occipital bone. It presents the anterior or internal opening of the carotid canal, and forms the posterolateral boundary of the foramen lacerum. Surfaces. Anterior surface. The anterior surface forms the posterior part of the middle cranial fossa of the base of the skull, and is continuous with the inner surface of the squamous portion, to which it is united by the petrosquamous suture, remains of which are distinct even at a late period of life. It is marked by depressions for the convolutions of the brain, and presents 6 notable points. Near the center, the arcuate eminence, eminentia arcuata, which indicates the location of the superior semicircular canal. In front of and a little lateral to this eminence, a depression indicating the position of the tympanic cavity. Here, the layer of bone that separates the tympanic from the cranial cavity is extremely thin, and is known as the tegmen tympani. A shallow groove, sometimes double, leading lateralward and backward to an oblique opening, the hiatus for greater petrosal nerve, for the passage of the greater petrosal nerve and for the petrosal branch of the middle meningeal artery. Lateral to the hiatus, a smaller opening, occasionally seen, for the passage of the lesser superficial petrosal nerve. Near the apex of the bone, the termination of the carotid canal, the wall of which in this situation is deficient in front. Above this canal the shallow trigeminal impression for the reception of the trigeminal ganglion, which lodges a tubular prolongation of the dura mater establishing a communication between the paralymphatic space and the subarachnoid space, and transmits a vein from the cochlea to join the internal jugular. Behind these openings is a deep depression, the jugular fossa, of variable depth and size in different skulls. It lodges the bulb of the internal jugular vein. In the bony ridge dividing the carotid canal from the jugular fossa is the small inferior tympanic canaliculus for the passage of the tympanic branch of the glossopharyngeal nerve. In the lateral part of the jugular fossa is the mastoid canaliculus for the entrance of the auricular branch of the vagus nerve. Behind the jugular fossa is a quadrilateral area, the jugular surface, covered with cartilage in the fresh state, and articulating with the jugular process of the occipital bone. Extending backward from the carotid canal is the vaginal process, a sheath-like plate of bone, which divides behind into 2 laminae. The lateral lamina is continuous with the tympanic part of the bone, the medial with the lateral margin of the jugular surface. Between these laminae is the styloid process, a sharp spine, about 2.5 centimeters in length. Between the styloid and mastoid processes is the stylomastoid foramen. It is the termination of the facial canal, and transmits the facial nerve and stylomastoid artery. Situated between the tympanic portion and the mastoid process is the tympanomastoid fissure, for the exit of the auricular branch of the vagus nerve. Angles. The superior angle, the longest, is grooved for the superior petrosal sinus, and gives attachment to the tentorium cerebelli. At its medial extremity is a notch, in which the trigeminal nerve lies. The posterior angle is intermediate in length between the superior and the anterior. Its medial half is marked by a sulcus, which forms, with a corresponding sulcus on the occipital bone, the channel for the inferior petrosal sinus. Its lateral half presents an excavation, the jugular fossa, which, with the jugular notch on the occipital, forms the jugular foramen. An eminence occasionally projects from the center of the fossa, and divides the foramen into 2. The anterior angle is divided into 2 parts, a lateral joined to the squamous part by a suture petrosquamous, the remains of which are more or less distinct, a medial, free, which articulates with the spinous process of the sphenoid. At the angle of junction of the petrous and the squamous parts are 2 canals, one above the other, and separated by a thin plate of bone, the septum canalis musculatubari. Both canals lead into the tympanic cavity. The upper one, semicanalis M. tensoris tympani, transmits the tensor tympani. The lower one, semicanalis tubae auditivae, forms the bony part of the auditory tube. Petrous bone in ancient DNA studies. In ancient DNA studies, scientists extract and sequence DNA from ancient skeletal remains of humans and other species. In many cases, the DNA is highly degraded and contaminated by DNA from soil microbes. In 2015, it was found that the Petrous bone has remarkably well-preserved DNA. 2. A 2017 study 3 comparing DNA from different skeletal sites concluded that the inner part of Petrous bones and the cementum layer in teeth roots are currently recognized as the best substrates for ancient DNA research. Both substrates display significantly higher endogenous DNA content, average of 16.4% and 40.0% for teeth and Petrous bones, respectively, than parietal skull bone, average of 2.2%. Consequently, Petrous bones are now the most widely used skeletal site for the study of ancient DNA.